Welcome to the Rob Call Bottom Up Show. It's available on Pacifica Radio and Progressive Radio Network and iTunes and Stitcher and SoundCloud. The complete archives are available at opednews.com/podcasts. And you can find out more about me at robcall.com. My guest for this show is Cindy Watson. She's an attorney who's been a social justice attorney for 30 years. She's the founder of Women on Purpose and the author of the book, Art of Feminine Negotiation. She's on a mission to reframe negotiation, how we think of it and how we do it, moving away from the traditional competitive model to recognize the power of persuasion through feminine traits. And she pitched me because I have a bottom-up show, and she says, and I agree, the feminine is a lot more bottom-up than top-down. So in a lot of ways, what we're going to be talking about, whether it's feminine or bottom-up, they're both very similar. And so we're going to get into that. And then we're going to talk about negotiating your healthcare, the bottom-up approach. And again, she's got an angle on how a lot of healthcare is top down. And I totally agree. There's a very bottom up way to deal with health, and then there are top down ways. And I think you need both, but mostly people think about the top down ways. And so we're going to get into that in the second half of the show, or the latter part of the show. Her website is womenonpurpose.ca. So it's great to have you on the show. Welcome.
Oh, thanks for having me. I'm looking forward to this discussion. I think it'll be interesting.
Yeah. So start us off by framing it. What's the difference between a masculine versus a feminine approach to negotiation?
Yeah, well, and I guess I'd take a step back from that first for sort of like how I came to this epiphany, because as you mentioned, I've been an attorney for 30 years. And I think like a lot of people in the practice of law, but particularly women, I bought into that myth that, the only way to define success is based on that, what I call masculine model. And let me start by saying this isn't based on gender. So when I talk about masculine and feminine, I'm not talking about women versus men. We've all got masculine and feminine energy. But for a long time now, I'd say for generations, we've really been conditioned to believe that the definition of success is based on that competitive model, right? And certainly in the law, and I think in business now, it's all about that win at all costs, be the top of the pile. And it ends up pitting everybody against each other in this really competitive, take no prisoners, rip it open kind of approach. And I bought into that, as you and I chatted before, my clients called me the Barracuda, and they meant it as a compliment. And I'm embarrassed to say I took it as a compliment and wore it like a badge of honor. And then there's a high cost.
So it sounds like what you're saying is the competitive masculine approach to negotiation is the win-lose approach.
Yeah, I think it's a combination. It's definitely, it's win-lose, but it's also very much, as you talk about, that top down. It's like everybody fighting to get to the top of the pyramid, right? At all costs, that take no prisoners kind of approach. And so to answer your question, what's the difference of the feminine approach? When I started digging in, thinking this can't be right, there is too high a cost to this. And it turns out, if you look at the key traits that make and mark the most effective negotiators, it's 5 out of 6 of those traits would be considered feminine. So, and I'll give you just a simple mnemonic to make it easy for your listeners to remember as well. So I call it the R-FIT model. So just think you are fit to be a great negotiator in life. So it's AREFIT. So you've got assertiveness, which most people assume is masculine, but I disagree even on that one, to be honest, because assertiveness isn't aggressive. And that's where I think the mistake comes. Assertiveness just comes from a place of confidence. Confidence comes from knowledge, and knowledge comes from preparation. And we can all do that and should do that. So it's assertiveness, rapport building, empathy, flexibility, intuition, and trust. And when you apply those traits with intention, you come out getting better relationships, better buy-in, more. Yeah, so I think, Rob, the problem is, and I bought into that myth as well, as do most people, and I think it's recent history when you think about it, that, women secured the right to vote or hold property, or heck, even be recognized as persons in the eyes of the law. So I think what happens with that is both men and women started to see the feminine as a liability. And so then both men and women end up eschewing the feminine. And that's why I think the world's been in a bit of trouble, because we've really tipped out of balance. As more and more people, men and women, go, whoa, those feminine traits are a liability. I've got to go for the win. I've got to go for that take no prisoners kind of approach. Then all of a sudden we start seeing this increasing imbalance where more and more people are looking for the golden ticket, right? To jump to get that top, vying for that spot at the expense of each other. And in doing it, we keep serving that, 1% or that top of the pyramid, if you will.
So give an example. Pick one of the five, and let's talk about that in a little more detail. Okay.
Okay. Sure. And let's pick empathy, for example, right? I mean, I think we jump into negotiations when you come from that competitive mindset and you're looking to get the win. So your focus in that mindset is your needs. How are you going to get your needs met? When you come from this, what I call the feminine art of negotiation, or that other approach, you start by saying, okay, what are some ways I'm going to build rapport? And let's pick that empathy. Let me put myself in the shoes of the other person. It doesn't mean I have to agree with them. I may fundamentally agree with their position or their politics, but when I try to truly put myself in their shoes, what drives them? What's their motivation? What are their stated needs? But more importantly, what are those unstated needs? The thing that really is the foundation that underlies everything that they're looking for and asking for. What are their insecurities? What's their deep why? Understanding that, like, just think about the difference that makes when you're going into a negotiation, truly understanding and appreciating the other person's perspective. It positions you to be way more effective at that bargaining table. And again, whether it's a formal negotiation or in your personal life, this applies equally. And I often say, from the boardroom to the bedroom, it doesn't matter whether it's personal or professional. It's a profound shift when you show up from this place of empathy. Truly, it allows you to listen more. It frames it for you to get curious and ask more interesting questions, which allows opportunities for more creative outcomes, better even than under the traditional model, because you're not just coming with tunnel vision looking to have your needs met. It allows the opportunities to spark for even more creative outside the box solutions. That's just one simple example.
And in my book Bottom Up Revolution, I talk about empathy. I interviewed Franz de Waal, one of the world's premier primatologists, and he's done studies looking at this. And what he told me was that empathy evolved about 200 million years ago.
Wow.
It's a part of our evolution, a very deep part of our evolution. And it's something that if you don't do it, if you deny it, then you're denying a core part of who you are, who we are as human beings.
Oh my gosh, I love that, Rob. That makes so much sense to me, because, and I do think, again, that pairs really nicely with what I was saying about the world being out of balance. I think we've really tampered down those feminine, which includes empathy and intuition the same. When you think, I mean, our First Nations sort of ancestors had tremendous intuition. They literally could tap into when somebody from their tribe was a 3 days walk away and have such a profound connection to know as they traveled on their journey. And somewhere along the line, as we bought into this more competitive sort of top-down model, we've really lost, I think, that empathy and intuition. So I love that you're.
Well, but then how does that work? How does intuition become a part of negotiation? How does intuition become a part of negotiation?
Yeah, well, I mean, there's a few examples I would say for that. So when you're in any sort of a debate or a discussion, or you're looking, again, if you're just coming from your brain and you're just looking for that bottom line, you end up missing the opportunity to tap into, like, have you ever had that experience when you're like, your guts tell you no, this just isn't a good deal, or there's something off with this person, or there's something that's really lacking integrity with this project, and we ignore it. We ignore those warning signs. We ignore those intuitions. And then people end up getting into bad relationships or bad deals and getting themselves in trouble or getting misled. And the opposite is also true. Sometimes we'll be in a discussion with somebody and all of a sudden if you allow yourself to be open to it, you trust yourself for that intuitive hit where suddenly an idea just pops in your head. If you're not in touch and you're not open to being in touch with your intuition, you're going to ignore that or you're going to miss the cue altogether. And you may have just missed a valuable opportunity because maybe that intuitive hit is the thing that's stopping the other person. It's the block, or it's the thing that they most need met or addressed. So when you're open and you tap into that intuition and trust in it, again, you're going to have more creative, fruitful, mutually productive discussions.
Okay, that makes sense. But let's say you're an attorney, you're representing a company or a person, and you're basing your decision on your intuition. How do you explain or justify that to somebody who's so used to this masculine top-down way of thinking?
Yeah, no, that's a great question. And I mean, first off, it's not pure intuition. Like, I'm not suggesting you go in unprepared and just fly by the seat of your pants, trusting you're going to get this gorgeous epiphany, moment. But definitely there are times, and I've had that through my practice, where I'm just trusting in that intuition on a particular point. And, and sometimes the proof is in the pudding, because when you allow yourself to tap into it, I can tell you, Rob, there've been numerous times when I've said, look, I know this looks great on paper, this sounds great, but my guts are telling me there's something more at play here. We need to be able to dig a little deeper. And part of it is building that relationship of trust. But usually when you say that, it's kind of like when you're in a room and you say there's no such thing as a stupid question. When one person raises their hand and has a question, chances are there's numerous people in the room who have it and just haven't given voice. And it's the same thing I find, Rob, with intuition. When you give voice to it, usually, and again, in my experience, Rob, is that once you give voice to it, there's almost always other people in the room who had that same it resonates with them because they had that feeling as well and they were ignoring it, or maybe they weren't even aware of it, but the minute you give voice to it, as I say, it resonates with them and they appreciate it. And sometimes the proof is in the pudding because the intuition actually then lines up with the logic as well, right? So, I mean, I've had cases I can think of where I go in with that, here's what we have to have model, right? And so focused on what we needed, and all of a sudden have that intuitive hit. Oh my gosh, I'm so focused on this result and listening to what the other side is saying they want. We could actually give them what they want or what they think they want, and it would be infinitely better for us. And then switching that gear and lining up that intuition with the logic of it and explaining it to the client why this actually is a better option. And here, okay. All righty. And often then, usually that intuition, you're able to line it up with the logic of it as well and explain to the client why, hey, here's why this is actually a better option even than what we thought we wanted. I know you guys came here thinking you wanted X, but let's take a look at this for a moment. If we step sideways and we follow this new path, here are all the reasons why that actually will give you more than what you thought you wanted when you came here.
When I look at this list again, the rapport building, the empathy, the flexibility, and the trust are the other ones. They're really, what they're doing is it makes me think of Riane Eisler's work with partnership, because really what you're doing is you're shifting from being in an antagonist relationship with somebody to being a partner. And you have a very different way of dealing with somebody who's a partner than somebody who you're trying to dominate or win over. There's two kinds of power. There's power over and there's power with. And so what you're really talking about here is creating a partnership rather than a domination scenario.
Absolutely. And that's why I think this flows so beautifully and why I love your sort of bottom up approach. I think it's brilliant. And I think now is the time. I think people are looking for a new global way of being. And particularly with COVID, I think for the first time, certainly in our lifetime, people are recognizing that this old traditional competitive, you know, go meet only your own needs model of life is not working. It serves the few at the expense of the many. And I think people are now starting to recognize we need to, and I love how you frame that, we need a partnership approach. We need a better approach. It's why everybody is loving the Prime Minister of New Zealand so much. I mean, she's coming from a very sort of, call it feminine, call it partnership. I mean, she brags about kindness being the new motto for New Zealand, and people are eating it up. I think people are finally open to this concept.
What kind of resistance do you get to this approach? I mean, this is something, do you discuss it with your clients, or is it just something you do?
Yeah, and I'll be honest, Rob, I didn't at the longest time at first, because a big part of my clients are, you know, doing social justice law. One of the areas is labor law. And within labor, most of my clients are trade unions, tend to be very sort of masculine dominated, you know, sort of industry. And a little old school in some ways. So for the longest time, I didn't talk about it because this idea about cooperation, and God forbid using the word feminine. So, and then I thought, you know what? No, I want to own it, and I want to be on a, and that's why you said in the intro, that mission to reframe how we think about negotiation, both what it is, the fact that everything is a negotiation, but also how we do it.
And what kind of response do you get when you tell people you're going to do that?
Well, it's funny. There was some resistance at first. You could see some of the eye rolling in that, but the results spoke for themselves. I mean, the fact that people started seeing success in new ways and in different ways, for not all, some are still resistant. I'm still working on, some are a work in progress, but definitely some of them are starting to see the value. And it's so gratifying watching some of the, you know, local union presidents going back, adopting these new ways in their interactions with management and in their interactions with their membership, and creating this new, you know, sense of solidarity, for want of a better term, again, certainly within the union ranks, but also in that partnership approach with management, right? And I'm not naive. I mean, sometimes if one party is still operating from the old competitive model, then that's something you have to factor into how you approach it, right? You still show up in this cooperative mode, but then there are certain ways, like calling out the behavior for what it is one, to be able to raise that awareness about it and shift that dynamic, right?
How would you, give an example of calling out that behavior?
So let's say you're in where somebody's using an obvious sort of what I would call a competitive tactic in negotiation, whether it's, you know, the delay tactic or the old I don't have authority tactic, or the opposite, trying to put a pressure constraint, like this deal's only going to be available, you know, if you take it right now. And just so for me, how I typically approach that, I literally will physically sit back in my chair and sort of put my hands up and give a little laugh and go, you know, really, Tom, or really, Joe, you know, I mean, are you really going to try that tactic here? Look at the approach we're coming from here, right? Here's what we're doing. I'm not coming from sort of competitive model, put one over on you. I could. Here's a number of ways I could have done that. Here's what we're trying to achieve. Looking for this. Are you really going to continue to use that tactic? Or the same with bullying. Like, really, is that the approach you want to take? And sometimes just naming a tactic will immediately diffuse its effectiveness, right? And allows things to get back on track. And if not, there's one case I can think of, Rob, where I kept trying to take the high road, and the other side was just so focused on that competitive model that I finally just thought, fine. And I let him use the momentum of that against him. I just continued to take the high road. Like, we were getting an agreed statement of facts on a case. So that means nobody gets to call evidence. You go straight to legal argument. And I was actually at the beginning trying to help him, give him facts that I knew he would need as the foundation for his argument. But he was in such competitive mode. Anything I said, he assumed he didn't want. And sure enough, we get this agreed statement of facts. And he's about 15 minutes into my final argument, and I could see the moment when the light went off, when he realized he had just completely screwed himself And the worst part for him was that he recognized that the facts that he needed to make his argument were facts that I had actually offered up to him on a silver platter, but he'd been in such competitive mode that he wouldn't accept them.
That's amazing. That's really cool. Okay, so we need to take a brief break right now for show ID, and we need to pause for about 20 seconds, and then we can continue.
You bet.
And my guest for this show is Cindy Watson. She's a social justice attorney for 30 years. She's founder of Women on Purpose and author of the book, Art of Feminine Negotiation. And we're talking about how there's a masculine top-down and a feminine, more bottom-up way of negotiating. And that this bottom-up feminine way is a lot more effective and powerful, really. And Cindy, you just gave an example of how a masculine top-down approach really screwed the guy who was using it. What are some other examples of masculine top-down approaches to negotiation, and maybe a bit on how you respond to them?
Yeah. Well, I think one of them is when people come just looking for their particular end result, right? That kind of competitive, put one over on the other approach. And, I've seen that again, just sticking with sort of the trade union context, where you have an employer that comes in with that top-down approach saying, we don't have to give what you're asking for because, we're the employer. And they take that very top-down patriarchal kind of approach. And then the union is able actually to take that back to the membership and say, here's what we offered. Here was the simple, obvious solutions that were available. The employer's refusing to do that. And here's where we're at now. And what it ends up doing is creating such incredible solidarity in a union that was potentially really fragmented that it ironically ends up giving the union infinitely more power than they would have had the employer taken that more cooperative approach. Because when you come from that bottom-up approach, that partnership, as you so beautifully characterized it, as I say, you end up getting better buy-in. You get those better relationships, which leads to longer lasting agreements, which leads to more overall positive impact. So I've seen time and again where employers bring that top-down heavy approach, or in civil litigation, the same thing, and it ends up creating such momentum and solidarity on the other side that they gain way more traction and get infinitely more than they would, say, in collective bargaining, where the membership was prepared to just accept status quo, but the employer decides they're going to jam it to them, taking this top-down approach. And suddenly we've got such solidarity and power within the unit that we're able to secure significant gains at the bargaining table that otherwise we wouldn't have without the employer having taken that sort of top-down approach.
How about outside of business? What about in relationships? Where does that, give some examples of how to think about it there?
Yeah, and I love that you've raised that, because I think most people do, and when I talk about reframing negotiation and what it is, very few people think about their relationship with their intimate partner as a negotiation, but it is, or your relationship with your kids. And one of the other elements of what I call the art of feminine negotiation, I call it the 5 secret weapons, or just the 5 W's. Just approach it, for example, with think who, what, where, when, and why, right? And when you're with your intimate partner, and you're about to have a discussion with them, first off, you apply the R-FIT model. And once you get used to it, it sounds like this is a lot of work, but it literally takes just seconds or minutes, to think, okay, what's the way that I can bring rapport to kickstart this conversation? So let's say you're having a challenging conversation with one of your kids about drugs. You don't want to come right in, for example, nagging and ragging at them about, all the perils of drugs, because their eyes are going to gloss over and you've lost them right out of the gate, right? So you start, what are some ways I can build rapport? Empathy, again, let me put myself in their shoes. They're thinking I'm just an old fart that doesn't know any better, right? Here, put myself in their perspective so I can reach them at their level, right? And be open to be flexible to hearing what they have to say and try and build that trust. Then you do the 5 W's. So you think, when is a good time to have this conversation? Don't broach the conversation when they're getting dressed on their way out the door to meet with their friends, for example. Pick a time when they're going to be relaxed, maybe a little more receptive, when you've already done something that they're really appreciative of. Pick your where with intention as well. Setting in books is a really important component of it. And there's good reason for that, right? Setting is important. So choose your where with intention as well. Some discussions should be taking place at the dining room table. Maybe some discussions you want to have while you're, on a family vacation together or somewhere. And the same applies in your intimate relationship. Some discussions you want to have in the bedroom. Some discussions should never happen in the bedroom. You want to have it somewhere else. And also the who should be involved in this discussion, right? Again, if it's the kids' discussion with drugs, just for an example, is it better for me to be there with my partner having this discussion? Or is my partner so old school that they're going to say stuff that is going to end up causing a negative reaction? So who should be there? And also, who do you want to show up as? Do I want to show up in this conversation in mom mode, or with your intimate partner in, wife mode or whatever? Or do I want to show up with a different sort of persona where we're just able to have a discussion? And I've made that mistake where I've approached my kids with discussions and I'm just so in mom mode, and it went sideways on me, as it's a want to do. And then I left going, oh my God, if I was dealing with a coaching client on this issue, I would never have approached it that way in a million years. I got so trapped in who I was showing up as that I botched the entire negotiation, right?
Yeah, and I was thinking, another scenario, and as parent-child is certainly one, is where there's one party that has a lot more power than the other party, like an employee and an employer, for example.
Yeah.
Now, of course, you're dealing with unions, which is similar to that, but it's even more so when you're dealing with an employee dealing with a boss. How do you frame that with this model?
Yeah, I love, great question. And again, I think the same principles apply. So, and because it is often the case, I mean, it will always be the case, actually, I'd go so far because, what is power? I mean, when somebody has something that somebody else needs, or somebody's in a position, you will always be in a power differential. Sometimes you'll be in the position of having more power. Sometimes you'll be in the position of having less. But that's where, when you come from this model again, where you're coming from a model of building rapport and empathy and flexibility, intuition and trust, and remembering the assertive piece as well. Because don't forget, all of that comes back to that assertiveness, remember, comes from knowledge, which comes from prep. So part of that prep work as an employee, for example, or anybody coming in with less power at the beginning, do your homework. 45% of success in a negotiation comes from your preparation. So quickly go through those 5 W's. Who do I want to show up as? Who are they expecting me to show up as? Who are they going to show up as? What's my deep why? What's really driving me? Even in negotiations about money, everybody goes, well, Cindy, your theory doesn't apply if it's just money, because it's just about the money. Well, I don't know if you agree, Rob, but it's almost never just about the money. It's about what that money represents for that person. Is it status? Is it prestige? Do they need to prove themselves to somebody? Is it getting that bonus, as you say, with the employer? Are they beholden to somebody even higher above them? What is their motivating why? And what's my deep why, right? And then getting curious about it. So when you do that homework, coming in with that sort of 5 W's template and that R-FIT model, you are going to be able to be more persuasive. And actually, I don't think I've used that word so far, but really negotiation, ultimately, when we're negotiating this thing called life, it's all about increase your influence, increase your ability to persuade the other side. And I sometimes call it persuasion, right? Again, that idea about bringing those feminine traits. Even if you have power, or if you're coming from a place of less power, either way, you're able to persuade effectively if you're going to bring something to the table that's of value to the other party, and you present it in a way so that they're able to see that value. It's that simple.
How would you advise activists who are trying to get, let's say, legislators to change things? How does that fit into the persuasion model? I love persuasion.
Oh gosh, so great and so relevant today where, because I think we have a really unique opportunity right now where, as we chatted about earlier, I think for the first time in a very long time, people are opening up to that concept about looking for a different way. And this is a beautiful example because for being an activist, this is a really critical model because again, if you come in, I think a lot of activists end up hitting brick walls because they get resistance, because most people get a little pushed back by, you have that pushback reflex to militancy, right? So very few people, if you look at the world population, the percentage of people who are prepared to step up through history and really be vocal activists are a tiny percentage of the overall population. So you need to be persuasive and influential to get a broader base. And the way to do that again is not by coming from a really competitive, pushed back at all costs kind of model. There are times through history where that's raised awareness and got attention, but most sustainable change has happened, frankly, when people get that grassroots kind of foundation. And you need that bottom up approach. Again, coming back to your sort of, I love that brilliant characterization of it. You build that grassroots foundation. And the way you do that is by building a sense of community, a sense of commonality, a sense that we have shared interests and needs. And you do that through persuasion and influence and building that rapport and empathy and connection and trust. That's how you build a movement. And it always amazes me. I mean, when you think through history, and working class people are a perfect example. The vast majority of any given, certainly let's take Canada and the United States, the vast majority of the population are working class people. And yet rarely have we had legislation that benefits working class people. And yet we carry the bulk of the vote. The vast majority of votes, if we could get that solidarity, that bottom up approach, we would hold all of the power. But when people are competing against each other, all wanting to vie for that golden ticket to be at the peak of that pyramid, you're not going to affect meaningful change. So coming from that ground, that bottom up, that grassroots, building influence, building persuasion, find out what people's common interests are and focus on that and build and get that little bit of traction and then take your next step, as opposed to jumping right in at the top with the militancy. That's been my experience.
One thing that it makes me think of is a lot of the problem is that a lot of people are authoritarian. Now, there are two kinds of authoritarians. So they're the ones that say, this is what you're going to do. And that's like 0.1%. And then the 99.9% who say, please tell me what to do. And what do you do when you're dealing with somebody on the other side of the negotiation who is an authoritarian type person? Now that's about as top down and as masculine as you can get. How do you handle them? What are the strategies for coping with them?
Yeah. And you, gosh knows, I've faced that numerous times over my career. And some of it goes back to what we talked about earlier. We're just calling out the behavior. Some of it comes down to being able to persuade and influence by showing them what's in their best interest. Because an authoritarian person, part of it is power, but part of it is them always wanting their needs met at the expense of everyone else. So being able to come from an approach and getting curious. Authoritarian people also tend to love to talk about themselves. It's all about them. They approach with big egos. And, I have one of my other templates is called no fear negotiation. It's that FEAR, no fear, no ego, no attachment, no reactivity. So when you're able to use somebody else's ego against them, get curious, start really asking questions. And next thing you know, it's very easy, if you're careful and strategic about how you do it, to have them end up coming to the conclusion themselves and let them think it's their idea, frankly. All right. If they need to be authoritarian and they don't want to believe they've been convinced, then just simply ask them questions to lead them to the obvious result that's going to be more creative and in their interest as well. That's one way to handle it.
I just gave that advice the other day. Somebody who was negotiating with someone else, and I said, come up with an idea, but let them figure it, that they own it, that it was their idea, and then they'll accept it a lot more easily.
Absolutely. Yeah. And the other on that A is don't be so attached to any result that you end up letting yourself bargain past the point when the deal no longer makes sense for you. Coming from that place where, with real clarity about, here's the outcomes that I want from this negotiation. And I think, Rob, people often make the mistake too of thinking of the outcome just being that thing that they want, the matter of the negotiation. And they don't think about relationship outcomes, which are equally often as important, right? I mean, unless this is truly just an absolute one-off, no need to ever communicate or see them again, which isn't most of life, being able to have that detachment where you're clear about what you want and those outcomes, both relationship and matter, and then being able to set the sort of foundation, be open and flexible to new ideas, but also not so attached to any particular result that you can't walk away if need be from that negotiation.
Can this apply to within ourselves? I mean, we rationalize things, we try to figure things out, we kind of self-negotiate. Is there a way to think about it in those terms?
I love, oh my gosh, you're like, you could have written my book for me. This is a big part of it. I think the first and most important negotiation you're ever going to have is the negotiation with yourself, negotiating our mindset, particularly because we all come with this deep conditioning. And let's face it, we've all got triggers and baggage that we carry, feelings of not enoughness, of less than, those things that we've carried since we were little kids, all those little boy and little girl hurts that we carry with us, being able to push past those and the fears. That's why that no fear template is soluble. We're afraid of rejection, most people, we fear rejection, we fear failure. And the often ignored sister to fear of failure is fear of success. So often we're actually afraid, profoundly afraid of succeeding. How will people see me? How will it change my relationships? And we end up self-sabotaging. Like, how often have you, either yourself or if you know people where, we're going along and we're getting traction and all of a sudden we plateau. And normally that's because we have self-sabotaged in some way because of our fear of success, right? Or fear of the unknown is a biggie as well. I mean, I've seen more deals tank or had to do work with clients to get them past that fear of the unknown, right? To be able to jump in and one easy way to do that is make a list of all the things that you think are the worst possible things that could happen, because usually they're not as bad. And now what are ways that you could resolve that if it did happen? And suddenly it helps them to get past that fear of the unknown because they're like, oh, you know what? I actually could deal with that. Let's go for it, Cindy. So.
Yeah, that sounds really good. Okay, so we need to do another show ID now, and we'll do another pause and then be back.
Okay.
My guest for this show is Cindy Watson. She's a social justice attorney for 30 years, founder of Women on Purpose, and author of the book Art of Feminine Negotiation. And our website is womenonpurpose.ca. We've been talking about a feminine bottom-up approach to negotiation, and now we're going to talk about negotiating your healthcare from the bottom up with a more feminist approach. So let's get into that. How do you conceptualize healthcare provision and access from this feminine bottom-up approach?
Yeah. And it's funny because, again, people don't tend to think of healthcare as being something that you actually can negotiate. And our healthcare system is structured as a very top-down sort of patriarchal structure, right? This profit-driven, business-based kind of approach. And that applies right from the, I would say, pharmaceutical industry with their incredible overreach to the actual provision of healthcare services. And then you compound that, Rob, because I think we're all tend to be so conditioned to offer this automatic deference to doctors and those healthcare professionals. So we don't think to question or challenge or even speak up sometimes in our own best interest. And that's why I think we've got a healthcare system that is so profoundly broken right now, just generally, and particularly in the mental health care system.
Well, I want to throw in that, I did polling on this about 15 years ago, and I was looking to see whether people wanted to be able to take more control of their health care and self-responsibility. And what I found was that people on the left, liberals, they were more likely to want to be told what to do by doctors. They wanted to be given prescriptions and what have you. People on the right, they tended to have a more libertarian approach. They wanted to be able to make their own decisions. And now, during the pandemic, we've seen a massive exaggeration of that. You've seen the people on the left saying, okay, yeah, let's wear masks, let's do the social distancing, and let's close things down. And we've seen people on the right say, I don't want to do that. And it's really exaggerated now.
Oh gosh, that is such an interesting example. And feel free to shut me down if I go in a direction, because that is a huge pet peeve of mine right now. I mean, I can't help but I don't know if you've ever read The Shock Doctrine by Naomi
Absolutely.
Klein.
I interviewed her about it. I love
Oh,
Doctrine.
I love her. And again, for the listeners out there who don't know, a very grossly oversimplified version is that sometimes the sort of in the top down approach, you get that sort of the top dogs, if you will, who end up either creating or taking advantage of disasters, whether natural disasters or otherwise, to ram through economic agendas or incredible sort of shifts in the way we show up that otherwise wouldn't be palatable. And I got to tell you, Rob, I can't help but wonder if COVID is just a new example of that. And I mean, she gave the examples of, Hurricane Katrina in New Orleans and 9/11 even, where we, ended up with the Patriot, massive expansion to the Patriot Acts and the Canadian equivalent. And with COVID, right, we're seeing this incredible absolute compliance coming from a place of fear without people asking some of the obvious questions. Like, none of the rules have made sense from the outset of the epidemic, frankly. I mean, just none of the rules. There's zero consistency. Your Walmarts and your large corporate stores are allowed to stay open, and yet, mom and pop shops aren't allowed to, in absolute lack of consistency. You can have certain kinds of big, when you're flying, the airlines haven't been required to do social distancing on the air. I was shocked when I flew, and I've got people sitting within inches on either side of me, and yet I can't have 10 people to my house who are friends, but not immediate family. And in the healthcare, oh my gosh, like this pandemic is being used as a purported rationale for everything from denial of services to refusing visitation, which then creates this total lack of accountability from our healthcare providers. It allows for abuses with very little oversight, denial of key programming, no social distancing among the patients in a lot of these facilities, and yet you're not allowed to have a loved one come and visit. So really exacerbates an already existing top-down problem in this, what I call an outdated model, right?
Okay. Now you describe you've had some personal experiences with this too.
Yeah, and I would say more
What are
recently,
your son both?
sorry?
You said you've had to deal with this with both your daughter and your son.
Yeah. And interestingly, my daughter was some time ago, so it's sort of much pre-COVID. And in fact, the situation with my daughter is where part of the concept for my art of feminine negotiation came from. My daughter got diagnosed with a very serious heart defect, had to have open heart surgery, and everything that could go wrong did. If 99% of the population reacted one way, Jade was always the 1% that reacted a different way. And at first, of course, I bought into that top down where it's like, okay, they know what they're doing. We're dealing with some of the world's leading cardiologists. And I would raise concerns and they would shush me. And I listened, but then all of a sudden, after the first couple of times when it turned out that my intuitive concerns, my common sense sort of concerns, turned out to be right, I started really just trusting my judgment and using that RFIT model where I was building rapport with the nurses, the doctors, the administrators. I was bringing empathy to the table, commiserating with them about budget cuts, for example, in healthcare, being flexible because the ground just shifted constantly, trusting my intuition, building trust with all the players, but ultimately, Rob, really being assertive and trusting that intuition and standing in my power, if you will. And it got to the point where they called us in and said, your daughter's not responding. We're going to have to go in and operate again. And at this point, she's like 5 months old. She's barely back to her birth weight and just totally not responding. And So I'd said, no, my gosh, there's a bunch of things that I think you guys haven't been doing. And one of the cardiologists looked at me and said, fine, Mom, if you're not going to let us operate, we won't, but we don't think she'll make it and it'll be on your head. And I was like, wow. And, wrong thing, like with much negotiation, sometimes it's not even what you say, it's that, sort of, it's how you're the body language around it. And he immediately knew from my reaction that he'd stepped in it. So they called down the chief cardiologist. And he goes, Mom, what is it you think we should be doing that we're not? And again, I just listed some common sense things, right? I want her medications cut dramatically. And at that point, you start to know how she reacts. I want her off this drug. I want her this drug cut down. I want this. I want her fed. I want this. I want this. And I listed them. And he said, if we do that and it doesn't work, can we operate? And I said, if you do that and it doesn't work, I'll be begging you to operate, but I need to know we're at the end of the road. And sure enough, we'd been in the hospital almost 3 months at that point, and within 1 week of them implementing the things that I asked for, we were out of critical care, up into the cardiology unit, and on our way home.
Okay, so what you did,
standing in your power and trusting.
What you did
Yep.
was you were dealing with a very aggressive, hyper masculine cardiologist. I mean, surgeons tend to be that way anyway, really.
Yep.
A lot of them. And you took a stand, you were assertive, and that led to you having another expert above the other guy come in who was not so aggressive, not so masculine, who was able to actually negotiate with you in a different way, really.
Yeah. Although to be fair, I mean, I think, and it's interesting because you're right, he definitely didn't take that more masculine approach. Although, truth be told, I think he was patronizing me or thought he was, but at least he was open to being flexible, and things would have gone a very different way had that not happened, right? So.
And everything worked out and your daughter's okay.
Yes, and now I'm happy to report that, my daughter is now, she's doing good. And when we left, they told us that she would need at least 3 further surgeries in her life as she developed, and she has never needed any further surgery. And she's off all of the medications and has been for years when they told us that she would be on heart medication for life. And you're right, we had a more recent situation with my son in the mental health sphere where my son was diagnosed with schizophrenia, and it's been beyond challenging. It is just such a challenging illness. You've got all of the stigma that comes with it. People don't tend to lobby for mental health changes because there's so much, shame and guilt and embarrassment and all of the sort of stigma attached. So there aren't really effective lobby groups. And oh my gosh, Rob, I will tell you that with COVID, it has been a nightmare, and it has been a constant negotiation. And I got to tell you, I've never been more thankful that I developed the art of feminine negotiation and didn't know I'd have to use it to negotiate with my own son. But it has been an absolute game changer in getting him access to some of the services and programming and healthcare that he needs, which would absolutely not be happening but for that kind of negotiation.
Well, give us some of the details of that.
Yeah, well, I mean, I guess at first the system is very broken because I think, if you go back historically,
Now you're
where,
in Canada, so you're in a single payer healthcare system now.
yeah, in Canada, we have our healthcare is covered, right? So it is a little different than in the US. You have the additional problem of having to negotiate potentially with an insurer, provider, or otherwise. So our healthcare system is supposed to be completely covered. But our mental health care system, I think, is kind of the sad sister in terms of the provisions of services. So, but interestingly, I have researched a lot since we got our diagnosis, and Canada and the US, our legal and medical structure around how we deal with severe mental health and schizophrenia in particular are very, very similar, if not identical. Like in New York, it's virtually identical to our province here in Ontario. And one of the problems is when we first started seeing what seemed to be indicators of a problem with us, with some really significant behavioral changes. And of course, at first you're thinking, oh, it's just those teen years, or, maybe we've got some drug issues that we have to deal with. but we reached out proactively for help. And the way the system is structured now, and again, going back, I think because historically, where we had people, with mental health, significant mental health issues, getting lobotomies or electric shock treatment, the system tried to swing away and the pendulum swung too far the other way, because now the system is that people have the right to be mentally ill and to make that choice. And yet the logic's kind of fatally flawed, because like criminally, they wouldn't be responsible for their actions, frankly, if they took them, if they were schizophrenic or had other psychotic mental health sort of episodes. And they don't have any insight. One of the fundamental indicators of schizophrenia in particular is that the patient, usually for their lifetime, even when properly medicated, don't ever recognize, rarely, that they have an illness. They don't accept it. So it's pretty flawed logic to say, oh, they get to make the decision about their health care and whether or not they need treatment. But at first, I wasn't negotiating. We were just accepting the system. And we kept being told, sorry, there's nothing we can do. If your son doesn't want help, then you're going to have to wait until there's a really serious incident and call the police. I mean, I'm like, okay, that is a pretty broken system right out of the gate. And we hear this over and over and over, and this applies in Canada and the United States, the same problem where parents who see a problem or partners who see a problem with their loved one aren't able to get proactive resources, even though the studies show that unless you catch it in that first or second, if possible, sort of psychotic episode, the chances of recovery reduce to significantly less than 20%. So that's a problem, a pretty fundamental problem.
What are the approaches that were provided for your son in terms of treatment and help?
Yeah, and here's but there's almost no, the treatment, if you can even call it that, is almost strictly just medicate. Here's what you need. Not only do we want them on medication, but we want them on injections, right? They need to be on injectables to keep it simple, to make sure that, and I'm like, what about cognitive behavioral therapy? Oh, we can't be offering that because of COVID. What about addictions counseling? Because cannabis use dramatically exacerbates psychotic episodes for schizophrenics. And no, sorry, none of the addictions programming is running. None of the recreational programming was running because of COVID. And that's where that negotiation piece came in, because I'm like, if the only, and especially in the hospital, I'm like, you are holding my son involuntarily in a hospital facility, and yet you are not providing treatment for him in any way. And for one of his hospitalizations, he actually went over a month not even getting medication, because they had to go through sort of allow the rights process, and everybody kept dropping the ball. And in the meantime, they're not even allowed to medicate. So he went over almost a month without getting any treatment whatsoever. So then I tried with the rapport building and the empathy, being flexible, trusting my intuition and trust. And when it came to the assertive piece, I'd recommend this for people as well, don't ever be afraid to raise the potential liability issue. So I would be saying, okay, let me get this straight. I just want to make sure I understand. So you're holding him involuntarily in the hospital, and yet you're not providing cognitive behavioral therapy, even though the studies consistently show that it would be a necessary corollary to help any success. You're not providing recreational programming. You're not providing any of the addictions counseling. The only thing that you're offering in the hospital is medication, frankly, and the staffing is cut on weekends, so they don't even have access to be able to see a psychiatrist. So if you're going to do that, I see my son's mental health actually deteriorating here, because now he's depressed on top of this. There's a significant liability issue here. And the opposite held as well, when on one occasion when they wouldn't take him to the hospital, because the test is supposed to be, you have to be an imminent threat to yourself or others. There's a whole range of really potentially dangerous or problematic behavior that doesn't elevate to that level. And they go, gee, sorry, doesn't meet the test.
It's scary. It's really scary what you've described, because you're basically you're basically in a situation where you're told what will be done, and it may not be enough. I did an interview a couple years ago with Bonnie Burstow. She's a psychiatrist who wrote a book, The Psychiatry and the Business of Madness. And she's at University of Toronto, not far from you.
Wow.
And I've delved into this area a bit myself. And the reality is that the worst thing you can do for somebody is drug them.
Yeah.
And the more medication you put them on, the worse their long-term perspective is. And the ideal thing to do is bottom-up social support, community and family support. And that isn't done because the resources are not allocated for it.
Absolutely. Absolutely, Rob. And I love when you said that about family and community, because you're quite right. That's where change happens. Have peer support programs in effect so that other people who've gone through the experience are in access, much like AA, frankly, but the mental health equivalent of an AA sponsor, having that peer support, having somebody in the community who actually comes out to the house to meet as well and see him, in his home environment, and being able to have that kind of outreach, having support programs where they're able to get together on outreach programs to be able to get access to recreational facilities, getting some of that insight and counseling around addictions issues, all of that support. And because it's not forthcoming, when you said about it being dangerous, this is why the few times we ever hear about schizophrenia or any kind of sort of psychotic related mental health issues, when somebody has, killed somebody, or there's been some horrific, tragic result. And there's, one recently in the news where the actual patient had asked to be rehospitalized and was denied access, saying they were fine. He was schizophrenic, and he ended up killing his mother and sister. And then it reinforces the fear that everybody has, this perception, when in fact, if they got exactly what you're suggesting, Rob, that bottoms up sort of foundational community support and treatment, and not just immediately trying to lock them up involuntarily and medicate them without getting other treatment, we would have way better prognosis for recovery.
So I spent 2 years when I was in grad school working part-time in emergency psychiatry. And when somebody is in an acute psychotic crisis with schizophrenia, they're so out of touch with reality. They can become delusional and hallucinating, paranoid, and they can be dangerous. And but here in the United States, it's often more dangerous for them, because if the police get called in and they're Black, they'll get shot to death and killed within seconds or minutes of the police arriving. So it's tough. That schizophrenia, particularly under acute circumstances, is a very difficult situation. But like you said, the way it's approached is so top down that it leaves out the best solutions. Now we've got to wrap up now. So any final words?
I would just say for people, start reframing how you think of negotiating your life. Negotiate your best life by showing up with intention, whether it's with your intimate partner, your kids, or your healthcare, or multi-million-dollar deals. Bring these models, bring that RFIT model. Think about the 5 W's. Think about that sort of fear model, and just elevate how you show up by negotiating with intention, and you will get better relationships, better outcomes, better buy-in, both personally and professionally, in every aspect of your life.
That's great.
And also, I just offered lots of free resources on my website, Rob, as well. So that 5 W's, I've got a free ebook on that. Have your listeners feel free to grab it. Full ebook on the no fear as well. So you've got some takeaway resources there to go a little deeper.
And the website is womenonpurpose.ca. And my guest for this show has been Cindy Watson. She's been a social justice attorney for 30 years. She's the founder of Women on Purpose and author of the book, The Art of Feminine Negotiation. Cindy, thanks so much for being on the show.
Oh, thanks for having me, Rob.